global rates of severe anxiety and depression continue to climb, leaving millions searching for ways to manage the daily neurological toll of these conditions. For decades, the standard medical defense line has relied on a specific class of synthetic tools: benzodiazepines for treating anxiety and selective serotonin reuptake inhibitors, or SSRIs, for treating depression. These medications provide undeniable relief, but they exact a heavy physical tax. Patients routinely endure chemical dependency, severe morning grogginess, dry mouth, and a pervasive, lingering cognitive fog. Achieving emotional stability currently demands a steep sacrifice in mental sharpness. But an alternative has emerged from rigorous clinical testing: a highly standardized oral preparation of lavender, known medically as siloxane. This chart shows the direct clinical trial data comparing these interventions. An 80 milligram dose of this oral lavender matches the exact anxiety-reducing efficacy of a 0.5 milligram dose of lorazepam, a powerful prescription benzodiazepine. When researchers increased the botanical dosage to 160 milligrams, it matched the clinical effectiveness of paroxetine, a common SSRI used in treating depression. A simple flower extract pulls the same biological levers as potent synthetic drugs, yet patients report none of the accompanying cognitive fog or chemical dependency. This data forces us to reevaluate our definitions of hard psychopharmacology versus soft natural remedies. It is crucial to note that swallowing raw, undiluted essential oils is highly toxic. Clinical efficacy relies exclusively on safely formulated, highly concentrated botanical capsules. Once properly ingested, the active molecules, specifically linalool and linaloyl acetate, enter the bloodstream and easily breach the blood-brain barrier. The delivery system and rigorous laboratory standardization dictate whether this plant acts as a poisonous irritant or a precise neurological medicine. A typical benzodiazepine works by binding to the brain's GABA receptors. GABA is an inhibitory neurotransmitter, meaning it suppresses neural excitability and physically calms fear centers like the amygdala. Oral lavender's active molecules mimic this exact process. They lock into those same GABA receptors to effectively shut down the brain's fear response. The botanical also exerts a compounding effect by blocking secondary structures called NMDA receptors. This directly halts overactive, stressed-out electrical pathways. By exploiting the same biochemical pathways as synthetic medications, oral lavender achieves a comparable state of pharmacological calm. SSRI medications operate by inhibiting the serotonin transporter, or SERT. This prevents the clearance of serotonin, keeping the mood-stabilizing chemical active in the brain's synapses for longer periods. Oral lavender performs this identical SERT inhibition. Simultaneously, it upregulates 5-HT1A receptors, a process that floods the neural system with even more serotonin. This dual-action modulation achieves chemical mood stabilization using purely botanical compounds. Synthetic central nervous system depressants depress the entire system, leading to unavoidable sedation. Yet when researchers measure electrical activity in the brain after lavender ingestion, the EEG scans show a significant increase in alpha and theta brainwaves. These specific brainwaves create a state of relaxed alertness. They push the brain into an optimal state of arousal without inducing sleepiness. As this research abstract details, the administration of lavender leads directly to a measured decrease in arousal, along with a sustained increase in attention. Clinical botanicals achieve a specific utility. They can regulate emotion without the corresponding loss of cognitive clarity. The psychiatric community is now increasingly deploying oral lavender as an adjuvant therapy, prescribing it to be taken directly alongside traditional antidepressants. This combination accelerates the patient's recovery timeline while actively reducing the negative side effects, like dry mouth, typically caused by the synthetic drugs. The future of psychiatric care relies on a strategic, synergistic combination of nature and pharmacology. Because oral lavender is a true, mind-altering medicine, it requires strict respect. If mixed with other sedatives without a doctor's oversight, it can dangerously amplify their depressive effects. Achieving safe, repeatable medical potency requires rigorous, laboratory-grade standardization to extract the exact molecular ratios needed. Modern treatment requires a shift from traditional agricultural harvesting to high-precision chemical refinement. Nature's chemistry, when carefully extracted and standardized by science, can rival our most complex synthetic creations. It offers a way to genuinely relieve the mind.